So we've got a full hour now for discussion.
Although you don't have to take it.
Perhaps I can just start off by making a few points that I didn't make entirely clear in my rushing through my slides. The libertarianism that we've heard referred to now from Dr. Winsley is essentially this, I refer to it as selfishness, or Ayn Rand describes it beautifully in Atlas Shrugged. It's a belief in personal liberty. It's not liberal in the sense of liberalism in Canada or liberalism in Australia. Liberalism is actually what Canadians call conservative politics. So you have to understand the terms and the definitions and the culture around these definitions. But a true libertarian is someone who, to put it simply, doesn't believe in taxation for the common good. You rise to your own, make your own efforts. Be an Arnold Schwarzenegger, come into the country, like the Cubans do into Florida. Come in, you aspire to individual freedoms, you do well, you have every opportunity to amass as much of a fortune as you can. So that's the one thing. The other thing that I think deserves some mention, we've talked about pharmaceuticals, we've talked about militarism. There is a thing, an entity or a complex, it's actually called the military, industrial, pharma, big pharma, the university complex. What you need to think about or realize is that we're all somehow complicit in all of these structures, because in universities we get to do wonderful research because the military has a stake in it, or big pharma has a stake in it, or big industry has a stake in it. Industry is often subsidized, certainly in Canada, by taking over from government programs. The research and development that was paid for by tax dollars sometimes gets spawned off, and it's done and it becomes part of the private sector. Well, the taxpayers pay for the research and development, and this may well be seen as problematic. It's not fair that this kind of subsidy takes place. The oil and gas industry in Canada, you've probably heard of the Port McMurray area and the tar sands, right? This Enbridge, the pipeline that they're trying to build from the northern parts of Alberta, where I live, all the way through to the Gulf Coast to keep the United States industrial machine oil and greased, and refine oil down here and export to China and do whatever one does to make money out of this current paradigm that we're committed to. It's all interconnected. So one has to be realistic in realizing these connections if we're going to try to understand how we might fix this problem. On the subject of Indigenous welfare, Indigenous rights, one of the other principles that I very much appreciate from native Canadian, certain Canadian bands in Canada, is this notion of the seventh generation principle. I mentioned several principles, I didn't mention the seventh generation principle. You can imagine it says what it means. Any decision that these bands takes today, they consider what the consequences of that decision will be 7 generations down the line. Think about that. If we could fire all of our ministers of the environment who just think about short-term profits for our commitment to the current energy paradigm instead of moving over to a green program and sticking with oil, which is just going to become more and more impossible as the years unfold, and add to climate change issues, they think about what the consequences will be 7 generations down the line. So this is just a very nice way of looking at consequences of decisions made today. And this is where we should look to the diversity of communities that have survived for millennia in this environment, and embrace them and include them and appreciate the diversity of these groups instead of the genocide that we've unleashed on so many of them. Look at their culture and look at how it could actually help us get out of the mess that we're currently trying to extricate ourselves from. So if you look at the International Society for Environmental Epidemiology Ethics Guidelines, we actually talk there about the need to do research on traditionally underserved populations. I showed you this 90-10 split. 90% of the research dollars goes to studying 10% of the problems. Well, now we're saying, let's try to correct that imbalance and do research on proper research, engaging communities that have been traditionally underserved. So There are people who've been thinking about these broader issues. The passion, the understandings, I think, go without saying. We know where the problems are today. A lot of it's being beautifully exposed through access to freedom of information. Tobacco was held under the carpet for some 50 years before that was exposed. Now we understand the issues there. So I throw that out to perhaps stimulate some thought-provoking, challenging questions. Feel free to go ahead. Yes, please. Do you want to? In the middle.
Hi, I'm Misha Brown, grad student, UT School of Public Health and Clinical Research Coordinator, Baylor College of Medicine. And my question would be in regards to what Dr. Winsley talked about. Could we transform the healthcare we provide in the United States by changing the reimbursement system for sick visits into more for preventive care instead of doing, I guess, like more bariatric surgeries? Why not accompany that with health behavior change that can be more sustainable?
I think that's certainly one of the steps that should be taken. We've talked about preventive care in recent years, but I don't know how much, those of you in the public health community maybe can speak to that more. But I mean, in a way, my argument about primary care is a form of preventive care, because if you actually have a regular encounter with your healthcare provider and you learn what you need to do sooner and how to take care of yourself, that is certainly contributes to preventive care. There's no reason that we should. One example, in Japan, doctors are paid for the time they spend talking to their patients, not just for the services or the tests that they run. That's something that we don't do at all. We don't combine healthcare with health education.
It's certainly true. For those of you who have, I would recommend that you see Sick Around the World. How many people have seen that? Sick Around the World is a documentary done by the PBS where the reporter goes to 5 capitalist countries to look at the quality of health care provided in those countries, all of them universal. And Britain was one of the countries to visit, and their payment systems, while British doctors get a set fee, they also get an add-on, a significant add-on for the health of their patients. So they have a significant interest in preventive care. But our problem is more fun. I mean, we can do those little tweaks, and I call them tweaks, within the existing system. The problem is the existing system is all wrong. And it's like tweaking on a house that is falling down in its foundation. Yeah, you can put a little new roof on it, and yeah, you might not get much water, but the house still gonna fall. And so you kind of have to deal with that. And the reason I say that is that we have, and this is part of what's the problem with the Affordable Care Act, we have a system, the whole for-profit profit system that is built into health insurance and everything else within our system is a completely wrong foundation for a public utility and a public service. Just think about it if we had for-profit roads. I mean, we do tolls, but that's another issue. If every road, if every sidewalk, if every passage from one point to another point was owned by somebody who was going to get their profits out of it, think about how travel would look like in this country if you could go nowhere without paying a private toll to a private individual. And that's essentially what's happened in our healthcare system. Everybody in the system wants their profit.
My question is to Dr. Ramley. You just said we need to change the foundation. What would be that first level, as you see it?
To start off with, well, I'm a universal health care component, and I would, if I had to do something, I would like to go to the provision of health care by the government and to everyone and let it be controlled down and just take profit. We could go to a Germany kind of system in which we continue to have health insurance, but the health insurance can make no profits off of primary care, no profit. So we can keep the existing insurance system we have, take all of the profit out of primary care, and I think trying to build on the existing system we have, like putting in a maybe public option, something like that, might have tweaked it a little bit. But I think fundamentally though, I don't know how to say the first step, because I think the only first step is decide to do away with it.
What do you think about Medicare for all?
Medicare for all, but understanding that any insurance plan won't get rid of access problems that are not based on the ability to pay. And that's the fundamental problem of the Affordable Care Act, is that if you don't have providers in the community, if the providers treat people differently, if people have to travel long ways, you're having all of these doctors and practitioners who want to do these large practices because there's an economy of scale, then the problem becomes is okay, when I'm trying to create an economy of scale within the delivery of a healthcare system, then I move to the suburban areas and have the people in the city commute out to me as opposed to existing within the city. But I think as an insurance plan, if we're going to have an insurance model, which is a number of capitalist countries have insurance models, if we're going to have an insurance model, we could have just voted to give Medicare to everybody. And that would be that.
Is that a consensus with your colleagues? Y'all think that might be a plan?
I agree with that, and I think a single payer system is far more fair.
More efficient as well.
Yeah.
You get away from all of those levels of people taking a cut for themselves up the system. A single payer gets you paying not nearly 19% of gross domestic product, but between 9 and 11%. It saves the entire country. That money could be channeled into food programs, into education, child welfare, etc.
And then you would have to couple that with a redefinition. I think part of redefinition, moving people into primary preventive care, community, I think really funding something like what the model that Cuba has. Cuba has, when you're a poor country and you want to get the health care, you make a model that makes it easier. So they have a lot of small community clinics, and then I think Britain does this as well, where the doctors are kind of like all over, so you're not very far from your medical home, and the doctors get paid, and we could incentivize it. You could pay that. The other problem though is that people like to go back to communities like the ones they came from. And so you gotta have admission standards into medical school, nursing school, social work school, dentistry school that are different. You can't just get people who say, yeah, I'm committed to primary care, because the problem is that commitment goes by the wayside when they get assigned to a poor community. When they grew up in a suburban white community and they get assigned to provide care in a urban or rural community that is very different from the ones they came from, then you get a high default rate on these medical from the medical support they have. So you got to have people who come from the kind of communities that you want to be served, so that because they're more likely to go back to similar communities, maybe not the same, but they're more likely to go back to similar communities and to be happy with that choice.
At my university about 25 years ago, one of the physicians insisted and spearheaded an initiative to, out of 160 incoming med students every year, to allocate 3 positions on top of that for First Nations people, Aboriginal, Indigenous people from Canada. It's now, that number has grown, it's been a huge success. Whether those people in the end decide to return to serve their bands is another question. I'm not sure of the data, what it shows, because I think sometimes they're human beings like anybody else, and they may be tempted to stay in big cities or to earn bigger money, or even to come down to the United States where they can make even more. So this is what happens. Unrelated to this, there is a question over there. I just wanted to remind you about one thing that came up this morning that is very much related to this conversation. The question came up, what is the influence of corporate or business interests in terms of international agencies like the WHO, the World Health Organization, policy formulation? And we have to be very careful not to look to the problems that we have locally as coming from or as existing only elsewhere. It's not always, it's externalizing the problem. Look to the United States, for instance. What goes on here, being pointed out not by me, but in the late 1940s, the American Association for the Advancement of Science started to bring to the attention that there were many more research questions than what government seemed to have funding to put into addressing those questions. They warned about the increasing, this is since the 1940s, so we're talking 60 to 70 years already, of the increasing collaboration between corporate interests or corporate money and universities. Look to your own universities in this country to see the way they are being constrained by the influence of money. They have to ask certain research questions and dare not ask other research. Read the book by Deborah Davis on disconnect, on cell phone radiation and brain cancer and other problems, behavioral problems, and what happened to her at the University of Pittsburgh. Read what happened on the 24th of October of 2012 at Harvard University on the question of aspartame, or how do you choose to pronounce it, this artificial sweetener, and how that research was originally announced to the public as groundbreaking nutritionist research, and then 30 minutes before the embargo was to be released for the paper to go online in the American Journal of Clinical Nutrition that published it, the university withdrew its support for the paper. Been trying to get answers. I'm doing an ethical case analysis of this and I hope to have it published soon. Been trying to get answers from the aspartame company, the sweetener company. I've been trying to get answers from Harvard, still not coming. So one is left to ask a lot of questions. What kind of pressure was brought to bear when they put forward such a study to suddenly distance themselves from it? Is it possible that the sugar sweetener industry said, you guys don't distance yourself from this, we're going to stop in providing endowments or supporting chairs for research? So universities are between a rock and a hard place. There are lots of questions. They've created monstrous institutions. They need a lot of stimulation by way that comes with funding. So they've got to walk a very fine line between what constitutes public interest research and what constitutes research that supports only corporate interests and is very narrowly defined to support the existing status quo. So sorry.
While you take that microphone, who's taking the microphone?
Over there.
Okay, just while you're doing that, taking it to the person, I just want to comment on our horrible human rights record in this country, and the fact that first of all, it takes us forever and a day to sign a human rights treaty. We haven't signed the International Treaty on the Protection of the Child. It took us almost 30 years to ratify the Racial Discrimination Treaty. And when we do it in a way that says, I find this always funny, because we always sign the treaty with reservations. That's a legal word. And those reservations always basically say, our citizens don't have any more rights than what we already give them. No matter what this treaty says, our citizen only has the rights that we find constitutional. Our country never allows our citizens to have a right to go before international courts because, hey, we have the best courts in the world. Why would our citizens need to go before that? And when other countries try to enforce human rights health standards, we protect business interests. I remember distinctly with the starvation of young children in many countries because Nestle was the practice that Nestle was engaged in, and our country says, we'd like to do something, but what can we do? Free market and all. So I'm saying, I'm going on is that we need to, our country is complicit in a lot of the things that are going on and around the world, not just the business, but our country, the government itself.
I think the statistic is that something like 70% of international treaties are not supported by the United States. Canada, about 5 years ago, reneged for the first time ever on an international treaty when it withdrew its support for the Kyoto Accord on climate change. So you can see the influence of the United States on Canada being its main business partner, but Canada's caught between its European values and its American business interests, and it never knows which way to turn on precaution or on these kinds of issues too. Anyway, please, question.
I'm Curtis Holland. I'm a student at UNC Pembroke. My master's is a Master's of Arts in Teaching and Physical Education. And one of the problems that I deal with on a continuous basis is that we tend to teach people how to save other people's lives. For example, swimming or CPR. Why can't we teach swimming to save their own life versus CPR, which is a mandate in North Carolina that we teach every high school kid CPR versus swimming. And within that, where does the self-responsibility versus self-accountability come into place? Because in Singapore, they make this great initiative that we want to teach them swimming because it's an island, and they want to separate themselves, but at the same time here, because of all these wonderful choices we have, people find themselves in a world of hurt. So where's the accountability? Not only for the legislation, but everyone involved.
Can I ask a clarification question?
Yes.
When you say accountability, are you talking about accountability by the individual who has the health problems?
Yes.
For health systems change, very little, from my point of view. Now, I'm a public health nurse who did public health counseling, and if a fat woman like myself came in to see me, I would say to her, you need to eat right, you need to exercise, you need to walk. Yeah, I'm going to say those things. But I'm going to also recognize no street, no food market, no swimming pool, so that the system in which they live, if I had to choose, it's not in my, first of all, I don't think it's an either or, but if you make it an either or, then I would choose health system change every day over individual responsibility. Because in the end, people do want to make rational choices. Kids want to go swimming if there's a swimming pool in their neighborhood. Parents want their children outdoors, but not if they're going to get killed. And if they don't have no playground. My community, there isn't no, the number of parks in my community on my side of the town can be counted on one hand. Okay, so the biggest change for health disparities is changing the systems in which they live. Individual responsibility is important, but it's like, yeah, so I said it.
Well, I was going to add on to that question because I hear a lot about changing the healthcare system, but what about more about the primary education? That way there are no disparities, even educationally, throughout that.
My chart dealt with that, but my chart dealt with but I focus on healthcare just as a narrow part because this is a Health Affordable Act. But as of all of the things, if I had systems to choose, it's not an either or. But if I had a system, if I had to work only on one system, it wouldn't be healthcare. I would not fix healthcare first because I think there's a lot of way people can deal with being sick. But if you don't have that there's other basic systems that need to be fixed first. But I don't think it's an either or. I think we have the time, money, resources to do it all. The only thing that we don't have is we have this libertarian, we don't want to tax. I think the reason why we don't fix things is because we don't want to pay for nobody else getting it. That we look at the person and we think, yeah, we want it for me and my family, but we don't want to be paying for those sorry people laying on their behinds over there. And so when we go to vote, we are voting our interests. I refuse this idea that people aren't voting their interests. Yes, they are. The interest in not paying for those other people getting something off of their taxes. That's the interest they're voting for. And until we deal with that, I don't know that we'll ever change how they vote.
I said earlier that I spent some time living in Sweden, and I've also been to Norway. They have the luxury of having high taxes, but they do have a homogeneous population. When the people from Bosnia were coming to Sweden, the Swedes didn't want to give them the same services that the Swedes got. So it's a real problem. We don't celebrate the diversity we have. We segregate the diversity, and we partition off groups that need more help. I agree with you. We need this. Healthcare is only one of the things that would make sense to change. I mean, we don't really have a graduated tax system because we have so many ways in which people can ship their money elsewhere. So corporations like Facebook and other big entities can deposit their money in banks that are not subject to American tax laws. They're just beginning to crack the Swiss banks, find out who's putting that money there. We are libertarians. I grew up in the Midwest, and everybody's a libertarian. You don't trust anybody else. So you have to have some kind of conversion to thinking about what a community is. I mean, we have to have solidarity that doesn't exist, but that doesn't mean we can't have it.
One additional thing. Everybody thinks the heyday of the United States was the 50s and 60s. That's the heyday when the United States was doing that. What do you think the tax rate was back then? 90% on the highest tax earners. And the reason we pay such low taxes is because they decided they didn't want to pay those taxes. And the reason we're in trouble is because all of us think, I taught a race and healthcare law course, and I said, what if I could come up a way which everyone in here would be well off with fully educated, fully housing, food, etc., but no one would be rich. Only 1 in 5 people would go for it. Everybody was like, I want to be rich. I didn't go to law school not to be rich, So I think that's the other thing that we have to be willing to say, that is, we're willing to pay the taxes necessary to assure the education, to assure the health care. And I wanted one more thing, we could go back to another question. If I had to choose one system, I think it's mass incarceration. Criminal justice, not just mass incarceration, the whole criminal justice system does such damage to, and I agree with the speaker this morning, that does such damage to the community that if we could undo that, then the community could begin to take care of itself in other issues.
And just 2 comments from me on it, since you both have gone on at length about it, but then we're a big discussion. We do have time still, and I see at least one more question coming up, if you could take the mic there. But in the meantime, just in response to your very thoughtful question, there is this ethical principle of autonomy, respect for autonomy, and that is the right to people to self-determine what they want to do. But again, it's not just a question of either or. You have to have safe systems within which people can make their choices for voluntary exposure or involuntary exposure. So when it comes to tobacco, secondhand smoke is involuntary. If it comes to me choosing to smoke or not, that's an elected decision that I make. So it's just important that you look at the question of autonomy, and again, I refer to my second or third slide with the live links to the book by the Spirit Level by Pickett anyway, the second slide, the book out of the Spirit Level is what it's called, and you'll see there that when you create the safe environments for people and you reduce the inequities in society, you have a much healthier society. It's just that everybody, it's make love, not war. It's all of those kinds of values that may sound questionable to libertarians, but in fact, to most people who go into the healthcare sector, they tend to be more empathetic. They tend to believe in taxation for the common good, and those are seen as good things. And it's demonstrated. You can believe what you want about it, but the evidence suggests that when you eliminate those disparities, when you create safe environments, you create a much more healthy society. And the United States is not one of those healthy societies in the world today. It's terribly unhealthy on many dimensions, unless you're very rich. Then it's phenomenal. You get access to remarkable healthcare, but you pay for it. Sorry, question back.
Hello, my name is Althea Raoul. I'm a graduate social work student from University of Houston. And my main question is regarding illegal immigration, particularly healthcare for illegal immigration. As we know, it is a big problem, 11 to 12 million undocumented immigrants, and how they're, quote, a drain or all these things, yet they do contribute in some ways to our society. So I wanted to see what your viewpoints were and your opinion on how we can solve that issue.
Let me just start with a quick response, because that's really not my area of expertise, but I can tell you, having been one of the first people to be involved in HIV and AIDS research in Canada in about 1982, 83, it became very evident that we have to take great caution in seeing the world as we and they. We're all in this type of situation together, and as soon as we find solutions together, then we will have a more helpful way out of any mess. But I'll let you go ahead.
I think it saddened me that the politics won and that people who are undocumented are not included. I think there's a lot of reasons. I think, first of all, on a moral value reason, we should say anyone who's in our border, period, for whatever reasons, however they got here, if they get sick, they get care. But for a self-interested reason, we should say the same thing. Because if you don't get care, we're still going to give you care. The whole fallacy is that we're not going to provide you care, and so what you're going to do, get sick, die, get sick, come home? No, you're going to get sick until you can't stand it, and then you're going to go into the emergency room, and then we're going to have a really sick person to deal with, and who's going to cost a whole lot more money. But my youngest son, who's an artist, spent quite a few years in several different countries, was in England for 5 years, and he got a splinter in his foot. And he was walked around with weeks with pain and upset. And his girlfriend finally says, well, why don't you just go down to the clinic and get that taken out? And he said, I don't have no money. And she said, you're in England, honey. And so I think we should operate like England. If you're here, like most countries, rich countries operate, we're not going to haggle over health, food, housing, and education. If you're in the borders, you get it.
No, it's a question of your values and your social priorities. It's just a simple question of, it really can be done. If the political will is there, the resources can be made available to solve these problems by changing priorities. Less wars, more local interest. Whatever it is, however those, I'm not saying that that's the way that the decision has to be made, but as an example, set priorities, decide on what your values are. If you believe the evidence that's coming out of all these studies, Michael Marmot, the Richard Wilkinson and Pickett, Kate Pickett, that's the name, the authors of that book, out of the UK, comparing American and British and other countries where there are disparities, and showing these trends in all sectors, in all dimensions, whether it's when you have wide disparities, you have the worst, the greatest illiteracies, the highest incarceration rates, infant mortality, you name it. It's just a very ugly picture. So people from a self-interest point of view in the healthcare sector might say, well, this is good for business. We'll treat it as business. So, you know, it's like people say, well, if we stopped everyone from smoking, then we'd have to shut down our cancer institutions. Well, that would be a bit of a disaster. I say, well, bring it on. We'll find ways of reassigning those institutions for other issues in society, or maybe we'll condominiumize it or turn it into people's housing or something like that. But, you know, there are, we are, especially in this audience, especially in the United States, I've given you in my talk numerous amazing intellects and talent. The talent pool in this country is astronomical. Figure it out. Just get engaged in the process and make the changes happen. That's my feeling. It's easier said than done, but it's a life task. It's, you know where the goalposts are. Now decide, do you want to work towards change, or do you want to just become absorbed in the current paradigm? I hope that most of you will come out of this program feeling motivated to say it's for change that you want to work.
With regard to your question about illegal immigrants or people who are not documented, it seems to me that we're very willing to give people driver's licenses. We're very willing to have them pay taxes. I have a lot of students at the University of Texas who were brought here as children. I have a Pakistani girl who was brought here by her parents when she was a year old, and she's doesn't have citizenship. I think that's crazy. I mean, I don't think we should just hand things to people. I mean, but anybody that's here, this is an opportunity for us to naturalize citizens and make them part of the community. It seems to me that we need to do that. We need to do it a lot sooner and a lot better than the current political proposals.
It's funny to me, and this will show you my values if I haven't showed them already. We have open trade, which actually demolished the industries in our bordered countries. But we don't have open borders for people who have to engage in getting employment. Imagine a world, which we could have, in which without dinging on the open trade, why not just have open borders and put all of our resources that we put in trying to keep people out into helping the countries they come from have better economies. That would be one way of solving the problem. We spend more time trying to keep people out when the very things that we engage in, like these open trade treaties, these free trade treaties, which then demolishes the economies, means people are going to keep coming here. We could make it where people are happy that people aren't coming here because they want to be here. It's like, oh, United States, so wonderful. No, they're looking for work. So let's help their countries have good work with livable wages where they're not exploited by American companies.
Any further questions?
Yes.
Thank you.
Good afternoon. My name is Jasmine Wilford, and I'm from Morgan State University. I was listening to the discussion from morning to right now, and most of them seems like they are higher in or more towards a more political change, although they are issues in our areas. And my question is there a way that we can directly influence influence the changes to be made on a political front as helped undergrads and graduates and mentors and people.
It's working.
What was this? Sorry. If you have any suggestions for us and recommendations as we still strive for financial success, because I know most people, like you said, we're not going to law school, we're not being nurses, no offense, to work to get impoverished wages.
Certainly, I know that the American Public Health Association has something like 50,000 members across the United States. It includes their affiliate members. And they provide amazing analyses at the time of political election time, where they will actually inform their membership, or anyone who wants to read their material, how their elected representatives have indeed voted over the past 2 or 4 years. And you can become very informed. They will also provide you with toolkits to go to election rallies and meetings and ask provocative questions. What do you stand for? What would you do in this or that situation? What do you care about issues of universal access as opposed to insurance and so on? So there are, again, incredible structures within this country that you can take advantage of for getting that kind of information. I mentioned earlier also creating space in your busy schedules to do collective action things. Don't just do individual things, but write letters to newspapers, engage with politicians, go to Congress, participate in protest march, inform yourself, have meetings with your peers. Even though there's the Homeland Security Act and all kinds of worrisome tendencies to try to squash dissent in the country, it hasn't gotten, at least from my naive perspective, looking at it from the north, it isn't quite as bad as what some people think it's heading towards. But you've got to take back this control. That's my view. What do you think?
I agree with that. I think that, first of all, I guess I sort of think that there's one step to say, I don't want to take steps to be impoverished. I'm actually doing to improve the financial status of my family. And I understand that. I made those choices. Okay? But people go beyond that. People go beyond that by saying, so I don't want to say nothing that people going to get upset with. I don't want to rough the boat because I might lose my job. I don't want to rough the boat because I won't get that pay increase. I had somebody say to me once that I expected them to support me in a faculty meeting and they didn't. And I said, why didn't you support me in the faculty meeting? And they says, well, the dean gives a 3% pay raise. And I'm like, 3%? You gave up your morals for 3%? So here's the advice I gave my son, both of my sons. I said, yes, you got to do what you need to do to feed your family, but in the end of the day, you got to live with yourself. And you have to have some values over which you're willing to lose your job over. You can't go through life saying, well, my job is the most important thing, because as soon as you make that decision, you're making a decision not to rock the boat. You have to say, when it comes, for me, for instance, it's like, they know if I'm in a meeting and a racial thing come up, I'm saying something. They know it, I'm going to say it. Did that happen price fee? No, I didn't get paid. There's all kinds of things that happened to me over my life. But at the end of the day, I knew that I had held on to a value that was important to me and risk it all so that I could be able to say at the end of the day that I just didn't do something for work. So I don't know what that is for you individually and within the context of health disparities, but you do need to figure out what that is. And then as you look for jobs, as you make decisions, you need to make them in a way that will hold on to that value. And then to that end, I think that there has to be a recognition that you have to stop supporting incremental change in the healthcare system. Incremental change is just going to continue this poor system, and there needs to be revolutionary changes.
The one thing I would say is that wherever you are, or whatever you do, you can certainly participate at your local level in whatever communities you're a part of. And I'm not afraid to speak out either, and I've gotten in trouble for doing it, but I don't regret the times that I have taken a stand on something that I think is a matter of important principle or some moral stand that I want to subscribe to. So, I mean, but that doesn't mean you have to devote your life to politics. You can do it in lots of different ways.
Yeah, and I think it's important to see this as not a one-step. We're not going to solve these problems. These are generational problems. We've allowed this to unfold and develop into the state that it is over many decades now. And in taking it back, it's not just that it's a one-step solution. It's a commitment to a life course to put us back on a path of sustainable everything. For the planet, for our well-being, for healthful communities, and so on. And to remind you of what Congresswoman Sheila Jackson-Lee said, find your passion. If your passion is consistent, at least in public health, with the values of public health and protecting the most vulnerable in society, then there's no way in my mind that I can see any justification for selling your soul out or selling your grandmother for a dime to earn $1 million to support a legal case that's basically showing that a community that has been harmed has not been harmed. And these billions of dollars has exchanged hands on the question of asbestos. There's litigation, tort actions all the time on these issues. So I like to work as an expert witness in supporting. Usually I'll support any case as long as the truth can be told. So far I've found that I'm only asked to defend communities or individuals who've been harmed. I've never had a corporation come to me and say, well, we need your expertise. And just to remind people in this room, I think it was your President Truman, I think it was Truman, who said, if you can't stand the heat, get out of the kitchen. And I think it was and he, in making that point, how it relates to this conversation, is that if you're working in public health, to me, public health is major advocacy work. It is research, yes, it is, but it is also advocacy, as I pointed out before. There's time to do research, and then there's time to inform, to take that research to inform policy changes. And one has to be able to stand up. Not to say that everyone has every skill to do both, but to be respectful of the fact that there are people who we need in public health who will do both. So if you subscribe to public health values, but you feel that the world out there is just going to be too rough for you to navigate, then maybe this is a good time to think of changing career paths. On the other hand, if you don't think that that's too much of a challenge for you, it's just an incredible opportunity. As I say, all of the stuff is being exposed. We know where the devil lies in all of this, literally. And we see it. This is being exposed thanks to jurisprudence, thanks to litigation that's going on at the moment. I mentioned this case in New York State exposing Georgia Pacific for having infiltrated the scientific literature with false studies and lying about who was supporting those studies. It's amazing. It reads like a soap opera in that it's happening in 2013. But this is there now, so you can embrace that and say, wow, I really want to become part of fighting this and getting us back on track.
My name is Shakira Williams, and I'm a student at UNCP. And my question is, I'm interested in advocacy and policy with a focus on mental health, and I want to know, how does someone like me with that passion affect change?
Through working in public health.
I'm
In mental health. Mental health issues.
First of all, you're going to have to more narrowly define. Over the course of your educational process, you need to focus in on some aspect of that. And then begin to, as you begin to define a narrower aspect of it, you will begin to find ways that you can make change and where you want to make change at. there's no way no one can tell you specifically do X, Y, and Z, and this is how you make change. Because if it was, I'd be rich, and I wouldn't be talking to you because we wouldn't be having these problems. But I think that you take it one step at a time, and you just kind of grow with it as it grows. I think I talked with people. People look at. I don't know about my panelists, but I know people kind of think, oh, she must have made choices all her life that led her here. Honey, no. When I was 21, I wasn't making choices for when I was 66. Yeah, I was making choices for when I was 21. But one of the things that my oldest son, who actually was born when I was in college, said that he learned from my life was that make choices that give you more choices. So as you begin to look at how to make changes in the system and all the choices that are in front of you about what to do, take the path that's going to give you more choices for making change, and that will help you. I don't know anything, I don't have any magic advice, and that's unusual, but
There are so many needs in the mental health world, whether it's to help children who are disturbed, or dealing with people who are institutionalized, or people who are falsely labeled as mentally ill. I mean, there are many different. I worked for 8 years in the psychiatry department at UCLA, and I ended up becoming an ethics consultant because of the complicated problems that the mental health professionals had to deal with. Because of that, I continued to do ethics consultation. I never had an idea that I was going to be an ethics consultant when I was your age. I didn't know I was going to be a lawyer either. And I do think, I don't always agree with Sheila Jackson Lee, but I have to tell you that when I was a graduate student in philosophy, my very first semester, I had a guy he was a very eccentric teacher, and I was a super analytical, rational thinker. And I turned in a paper that I worked hard on, and I really refined it down to the detail. And you know what he wrote on my paper? Where's your passion? And I took it seriously. And I decided that, I would go with what I'm supposed to do. I think in answer to you and to you both, you don't know what's going to happen. You don't know what your options are going to be. So I agree with you. Making choices to keep open doors for the future is a very good piece of advice. I agree with you.
Yeah, I would say identify your values to support people with mental health issues, whether they're even induced through toxicity, through environmental pollution, whatever it is, that behavioral problems. Subscribe to a good code of integrity and be passionate. Yours, in my experience, will always, if this lady came to you for a job, how would you say no? She's so passionate. You just be passionate, learn your stuff, do well, take it one step at a time, and I'm convinced that doors will have to open for you. When that stops happening, then I think it's game over for all of us. So just be passionate and subscribe to good values and have integrity, so that you can sleep in a clear conscience at night, that you serve those values to the best of your ability with passion.
And I also say don't get discouraged, because even though, doors don't always open because you have passion, are smart, are qualified, are the best qualified, and as a matter of fact, getting back to race, plenty of doors closed. I graduated 10th in my law school class and could not get a job out of law school. And my dean was embarrassed because the message that they had always sent was, we haven't hired anybody because no one qualified. I had two master's degree, 15 years of nursing, and 10th in my law school class, and it was graduation time and everybody around me had a job. And my dean came to me and said, if so-and-so, this particular firm, offer you a job and would you take it? And I'm like, I'm a single parent with 2 children. If the devil came in the job. And so I don't want to make it seem that you're not going to run into doors and barriers, and they are going to close because you're a woman and you're a member of a minority group, or you have an accent, or all the reasons Americans discriminate can work against you, and the more of them you have, the more likely. But that shouldn't stop your passion, and that shouldn't stop you from making the best choice you can under the circumstances and keep it trucking.
Another question in front. Oh, sorry, one over there and then one here. And then I think we're going to have to call it. Oh, and one at the back. Okay, so after those 3 questions, we'll have to close it, okay?
Yeah, thank you very much. My name is Mohammed Abubakar, a student of peer review. I think it's been a very wonderful presentation, and all the speakers have done a wonderful job. I do know it's just going to be a form of request. When Dr. Jones was said, when it was about getting one of the speakers, the one we had over the video conference, that he sent an email, never get a reply to that email, or to say we should speak to one of his friends before he later get a response. So my request would be this: I know some of us present here might have picked one or 2 things that we'd like to follow up on. So if there's any opportunity for us to follow up with you, I do request that you should please give us, a timely response so that we will to, further on our, because this has been a lot of courage for us, and if there's a way we can have a little bit of your information by which we can contact you if there's any need. So, thank you.
Well, let me speak perhaps on behalf of my colleagues here. Certainly, I've been doing this, like 6 or 7 years in a row now. 8 years, wow. It's been such fun, it doesn't seem that long at all. Because it's wonderful to talk to audiences like you, and this program is got, I love to come here and do it. Doors will not always open. And this relates, if doors are not opening for you, don't hesitate to email one of us and say, I'm having this problem, what do you advise? So I would say to you, well, maybe contact your professional society, maybe contact the ombudsman at your university. We may have some suggestions to help you over hurdles. I mean, life isn't exciting if they're not challenges. So don't see it as a major setback or put off or put down if doors don't open readily for you. I mean, that's too easy. We've got big challenges ahead of us. There's powerful interests that we're fighting that we need to change. We need to educate. We need to inform. We need to transition this whole ship into a new direction. So see that as an exciting opportunity. And absolutely, my email address, I gave you my website. Email me, you get a reply probably within hours, certainly by the next morning, wherever I am in the world. I think the same would be true here.
My email is randall@udayton.edu. Randall@udayton.edu. I certainly will respond to your emails. And I have a website called racism.org. It has a huge health section, but it goes into other aspects of racism.
The easiest way to communicate with me by email is just my name, williamwinslade@gmail.com. I'm not as quick because I don't sit in front of my iPad. Well, I have a phone that has everything on it, and so I will get back to people, but probably not as quickly because I'm not quite as swift.
There's another question here, one at the back. Can we?
First, repeat your email. You said Randall at
udayton.edu. And of course, if you lose it somewhere, it'll be sent out. Yes.
My question is directed at you, Ms. Randall. You mentioned 2 things earlier. One was providers refusing to accept service.
Accept patients who had Medicaid and accept particular insurance, yes.
And the other one was the lack of hospital facilities.
Within urban areas, yeah.
Okay, so. I've been sitting here trying to figure out when the affordable health care actually goes into effect for everyone, well now it won't be everyone that will have access to health care.
They will have insurance plans that will pay for it if they can find a provider to take it and a hospital to go to.
And that's where
If they,
right, because I work in a community health center,
right.
and it has been the assumption that everybody will be able to go wherever they choose. So that's
Well, that's true. They can go wherever they choose. If they choose to travel 10 miles outside of town to the only hospital, if they choose to go to the community health center, the only community health center that may be in their community, so they can go wherever they choose, that doesn't mean they have the capability of going. And so we're still in the same situation where people without cars, people, our healthcare system is built on sort of a middle class model, in terms of people can take time off of work and go into a doctor's office. And so if you are working a minimum wage job, even not, so let's say you're making more than minimum wage, you're making $10, $12 an hour, still taking off a half a day to go see a doctor, to go see a provider may be a huge economic blow. So still in the end, especially if the providers are not located close. So it's true, this I think is sort of the, I don't know what to call it. It's sort of the marketing that I find disingenuous. It is true to say that people will be able to go wherever they want to go. But that doesn't say that the people have to take them. And that they're located somewhere where there is availability. Go ahead.
Okay, pretty much we've been talking about the disparities in the treatment, it sounds like, of individuals and concerning what we're receiving from the doctors or from the health community. And what I found in just my experience with my mother, when she was coming down with Alzheimer's, it was a problem, disparity in getting information. So I would say it's not only just in treatment, but also in the trickling down of the information to individuals, because a lot of that information was locked into the agencies, but it did not trickle down. And what type of efforts are you making in eliminating that and actually making it more accessible to everybody so that they can receive the proper information, that the individuals on the end user can actually receive the proper treatment? Because if you don't know the information, the treatment's not going to help you if it doesn't trickle down all the way. And that's what efforts are you making in doing that?
In my experience of that in the HIV literature is that if you have not yet communicated with the Alzheimer's Society of the United States, you should be reporting that kind of thing to them. I think that they would be acting in your interest. I would like to believe that they would take your case very seriously. Information is meant to be targeted at all parts of the community that are affected in whatever language is necessary, especially in North America where there are so many different language groups as well. I don't know if that helps answer your question. Have you tried communicating with... Oh, and you did not get success from them? Oh. Where are my American colleagues to advise?
I think the problem is you focus on a fundamental problem. Is the problem of lack of information is a huge problem, and even the way they plan to solve some of those problems through technology assumes that people have access to the technology and or want to use it in terms of technology. I'm not doing anything in particular solid. My focus is not on health information access.
Now, the only thing I can say is keep trying. With regards to the agency, there must be someone within that agency that deals with community outreach and really report it to them. And if you get no answer from them, the next best place to do it is the Business Bureau. Yeah, or you're a congressional representative in the area. One of the things that I tell individuals is to get to your representative's chief of staff. Don't get to the representative because the representative has 10,000 things on their plate, and it's very hard to really get their attention. But if you get the local representative or even the representative in the office in Washington, you will more than likely get results if you continue to ask them to be able to see you. I often tell people the idea is that when you want something to be done by your congressperson, the best place to do that is with their legislative aid and not them themselves, and make personal relationships with them. Don't wait till there's a major crisis that you have to deal with, but make it an ongoing thing. Even if you do make it as an issue with a crisis, go back to them and report back to them what if they've been of help or if they've not been of help. But get back to them and let them know that they've been of help to you or they have not been of help to you. And they will surely respond in that way. Whereas you're trying to get to that representative. They are one of 10,000 people they may see doing their, just as the congresswoman came here, she was going to another major event that probably had just as many people and just as many people pulling at her coattails. She probably was going to go to the third before she got on the plane heading back to Washington. But that aide that was with those two aides that were with her, if you slip them a note and let them know that you're in need of help in terms of something to be done, and then follow with them, they more likely will make sure that gets done. In Texas, I may not work too much. He was saying a copy of a letter to a newspaper. Sometimes, but Texas is a whole different animal in that. And one final comment I would say in terms of, for those of you who are living in Texas, and I don't know, to me, and I'll tell you, I have a good number of friends in the Obama administration. Some tell me that I speak too much at times. Some who have been my mentees over the years, and so I have access to them that some people don't have access to. But I've said to them that unless they really start listening very strongly, health reform in the state of Texas is going to be a disaster for the nation. It will pull this country down very rapidly unless something is really done. And I'm not saying that just out of scare tactics, but out of reality. The city of Houston will have approximately 600,000 people who will fall into that donut hole. They heard my comment that when they were talking about some of the problems with it, there are going to be 600,000 people who will not have insurance when the health reform, and even if they are contacted, they will not have health insurance because they will fall through that crack of earning too much for subsidies and not earning enough to pay for the insurance, and will be sitting around waiting for the IRS to track them down. That's a major issue because with the implementation of the Health Reform Act will come the reduction in safety nets. And there are two areas that you may have mentioned with regards to the Emergency Room Act. When the emergency room changes their name to urgent care, they do not longer fall under that law. And so if you've seen all these emergency rooms changing their names to urgent care or something along those lines, they no longer fall under that law. Therefore, you can show up on their front doorstep and they do not have to take it, because technically they are no longer an emergency room. Just by that change.
And I meant to comment on this. I want to make clear that Impala doesn't require care, it requires screening, and it doesn't you don't get it for free, you still have to pay. So it's not universal health care in the sense that you can go there, get it, walk out, and someone else is going to pay for it. It's just if you have an emergency, then they have to do it, but you still have to pay for it. Yeah.
And the third law that covers, and I can't think of the actual number, has to do with cancer. If you're stage 3 or stage 4 patient, you are 100% eligible for Medicare and SSI. You have to fill out the paperwork. And it's the paperwork that catches you in terms of that. Yes?
Is that regardless of your age?
That's regardless of your age. But unfortunately, you have to fill out the paperwork, and the paperwork is what catches people. Because if you don't fill it out right, it's an automatic rejection. If you don't put the I in the right place or check it in the right box, it's an automatic rejection. And they do not tell you what the rejection is for, they just tell you it's rejected. And so most people don't do it.
What, do they let you know if it's rejected, or is
Oh yeah, they'll send you a note saying it's rejected.
But can you reapply or no?
You can try, but you don't know what you're replying to because you don't know why they rejected it. So, it's a game.
Is that nationwide or just your type?
It's nationwide. Yeah, it's nationwide. Let me close this out by thanking the three speakers.